brief update on cases. 2,655 new cases yesterday. Hospitalizations increased by 11 to 1,576 people hospitalized from COVID right now. Just to put an exclamation point on that, only 256 of the people hospitalized are vaccinated. 1,320 are unvaccinated. So if everybody was vaccinated, we wouldn't be here having a press conference. 200-300 people in the hospital is within the norms of hospitalization numbers in our state. We often have that many hospitalized from the flu in the height of flu season. Having 1,320 unvaccinated people in the hospital, that is why we're here. That is the why we're expanding hospital capacity by 500. That's why we're acting urgently around expanding monoclonal antibody treatment. That's why we are continuing to push the urgency of getting protected, getting vaccinated, and getting the booster shot if it's been 6 months, also absolutely critical. We have lost 9,219 Coloradans due to COVID. Each one, a friend, father, mother, sister, brother. My heart goes out, and I express sincere condolences to every Colorado family that's experienced loss during this pandemic. We remain in the bottom 10 states for fatalities per capita. And of course, we want to keep it that way with continuing to make sure we have the hospital capacity to treat those in need. We expand monoclonal antibody treatment, which can reduce hospitalizations by about 70% when administered in the first week of a COVID-19 diagnosis. And of course, continue to work on increasing our vaccination rate and making sure that people get their vaccinations 6 months after Pfizer, Moderna, or 2 months after Johnson & Johnson. I know I'm excited to spend time with family this year. I know many of you are as well. And I think it's important for Coloradans to know that we can celebrate and gather, and we should do it in a way that minimizes risk to the health of our loved ones that we have with us. First and foremost, hopefully everybody at your Thanksgiving table is vaccinated. And it's also important, especially if there are unvaccinated folks attending, that if anybody has symptoms, is sick, fever, runny nose, headaches, that they opt out of attending that Thanksgiving dinner, because if they're vaccinated, what might be very negligible for them could very well kill an unvaccinated family member. And I don't think anybody wants to kill an unvaccinated family member, however frustrated you might be with them. You still want them to be able to live and not contract this deadly virus. I would also encourage everybody to get the booster dose. It won't have added protection in time for Thanksgiving, but it will for Christmas and the holidays. So please get that booster vaccination if it's been 6 months. The data couldn't be more clear on how the three-shot course booster bolsters immunity. I got my booster many weeks ago. My parents did. My family members who are eligible have. And I want to applaud the Center for Disease Control and their action last week that really cut through any of the confusion around booster shots and made it clear, unambiguous, simple. After 6 months, you need a third shot. But just remember, when these shots were newer, nobody knew whether you'd need a third shot. It turns out there's lots of vaccines, like the DTaP vaccine your kids have probably had, which are three shots. What remains unknown about this one is whether 3 shots has enduring immunity for 5, 10 years, or a lifetime, or whether there are, in fact, boosters that will be needed in future years. That, however frustrating that might be, the virus simply hasn't been around long enough, nor have people been boosted with a third dose long enough to know that. So that we'll have that data in another 6 months or a year, whether the immunity is enduring or whether people need another dose. But at least for now, we know that after 6 months, yes, you do need another dose. You are protected with the 2, but you have a much higher level of protection with a virus as prevalent as it is, especially gathering family members during the holiday season. I encourage everyone to get the booster. We also want to make sure you know how easy it is to get a booster appointment. You can call 877-268-2926. That's our hotline, 877-268-2926. People will help you schedule an appointment. We're also ramping up some of the larger sites that can do large numbers per day. Douglas County Fairgrounds is expanding to be able to do 1,000 per day. Pueblo Mall expanding to 1,000 per day. Chapel Hills Mall, Jefferson Marketplace, Ball Arena, a number of other sites. So you can go to covid19.colorado.gov/vaccine. But if you want help navigating where to get your booster, call 877-268-2926. There is extra capacity every day to give boosters. There are, of course, other sites that they might be booked for that day. But as long as you're flexible on where you go, you should be able to get in within a few days in a minimal drive from where you live. And I encourage folks to avoid putting it off and to get it done. Beyond your individual responsibility to protect yourself, there's also ways to increase safety in group settings. Consider gathering outdoors, especially if there's members of your party that are unvaccinated. We're blessed with unusually warm weather this Thanksgiving season, so you can take advantage of that by having an afternoon outdoor Thanksgiving event. Keeping the guest list smaller than usual, shortening the length of the celebration can also lower the risk of contracting or spreading COVID-19. Testing is also very important. You can get a PCR test a few days before a gathering, even take a rapid test on the day of the gathering. They turn around results in 15 minutes, and that's another level of support. This is a policy we often use in the governor's office, where people who meet with me are tested, and I encourage many other employers, families to consider doing the same thing when they want that added level of protection, again, particularly if there are unvaccinated attendees at the gatherings. And as I said, very importantly, if anyone is experiencing symptoms or knows that they've been exposed to COVID-19, stay home for the sake of your loved ones, and of course get tested as quickly as possible. COVID is not a gift you want to give to your loved ones this Thanksgiving or Christmas season. We've worked hard to make getting a COVID test free, quick, and easy in Colorado. There's hundreds of testing sites across the state. You can visit covid19.colorado.gov/testing or call 877-268-2926. That is the same number that can help you with testing or booster vaccinations. They can also help you with monoclonal antibody treatment, the third action item that the state is boldly taking action on. Monoclonal treatment is highly effective for Coloradans who've recently tested positive for COVID-19 and have moderate to severe symptoms. It can reduce the likelihood that you have to go to the hospital by about 70%. Now, to be clear, that's not as good as the vaccine. But once you have COVID, it's too late to get the vaccine. So what should you do? You haven't been vaccinated, you got COVID, get monoclonal antibody treatment. It's the next best thing to the vaccine. 70% less likely that you'll wind up in a hospital. You need to get it within the first week or so after you get diagnosed. It's too late after you need hospitalization. That therapy no longer works. It works early in the stage of disease. If you got COVID recently, you can call 877-268-2926 or visit covid19.colorado.gov/monoclonal. For more information, we do have additional capacity in this area. It's available for everybody 65 and up who contracts COVID because you are at risk simply because of your age, and as available for people that are younger with pre-existing conditions that could put them at higher risk, asthma, diabetes, etc. We're working with 160 monoclonal antibody treatment centers. We have 5 mobile monoclonal antibody buses deployed across the state. We expect another 5 buses to come online the first week in December. And in addition to these efforts, we're working with Health and Human Services to build, to bring 3 new monoclonal antibody locations online. Each of these will be able to give about 900 doses per week. UC Health in Loveland, Parkview Hospital in Pueblo, and the Family Medical West Clinic serving the Fruta Mesa area. And the goal that we charged our team with and we expect to reach is that by early December, we expect that we'll have the capacity to give about 7,500 doses across the state each week. Which, based on our projections and trend of where we are, we expect that to meet the demand, meaning there'll be about that many folks that have moderate to severe symptoms from COVID-19 are at risk and would benefit from monoclonal treatment. But it also relies on you getting tested and early diagnosis. Again, it doesn't do any good if you're putting off getting tested, you're sick, you think you might have COVID, you wait, you have to go to the hospital because it gets worse. At that point, monoclonal antibody treatment cannot help you. So please escape any state of denial that you might be in the early days of your illness for your own good. Get tested. If it's not COVID, you have something else. You may need to see a doctor, maybe the flu. If it is COVID, monoclonal antibody treatment can be extremely effective if you are at greater risk of this virus. This weekend, last weekend, CDPHE issued a public health order that clarified that individuals who meet the eligibility criteria for monoclonal antibody treatment can get that treatment at a state site or enrolled provider without a doctor's referral. Again, you can go right to get the treatment. You don't have to worry about setting up an appointment with a doctor. That could take a week. It might be too late to get the monoclonal treatment by the time you get it. You test positive for COVID-19, you have moderate symptoms, monoclonal treatment reduces the likelihood that you will have to go to the hospital. Not as effective as the vaccine, but that's water under the bridge. At the point you're experiencing moderate symptoms, if you weren't vaccinated, get the monoclonal treatment. If you haven't been vaccinated yet, please get vaccinated. If you are eligible for the booster, please get boosted. There's really three key things you need to remember. Vaccines, right? Get vaccinated and get boosted. And of course, also wearing a mask around others in indoor areas and getting tested, both before and after celebrations as well, is the right and neighborly thing to do. We have a lot to be thankful for as Coloradans. We have a wonderful state with some of the best outdoor recreation opportunities in the entire country. I look forward to taking my family skiing shortly. Beautiful weather that is as long as you like the sun and not fog and overcast weather. Colorado has that weather for you. Great cultural facilities, great opportunities to have fun. And the vast majority of Coloradans are moving forward from the pandemic. They've gotten vaccinated. They're doing their part. They're getting boosted. We're at about a third of Coloradans who are eligible have gotten boosted, and more every day. And for Coloradans making the right choices and doing the right things, I am grateful this Thanksgiving season. And I want to thank each and every Coloradan who's risen to the occasion during a most extraordinary year and taken the steps to protect themselves and their communities. I want to wish everybody a safe and happy Thanksgiving for all. And with that, we're happy to open it for questions.
Rather than doing something, on a statewide kind of level?
Yeah, so we've had, different local approaches to reducing the spread of the virus in different parts of the state. We've seen counties like Boulder County that have had mask mandates for several months. There's additional counties that are adding mask requirements in different settings. We also have counties that are really focused on doubling down on improving vaccination rates and boosters. And we're excited to work with every county across the state, recognizing that we're a very diverse state. And I have great respect for the county health departments in all parts of this state, whether in El Paso County and Douglas County and Denver and Jefferson County, and all have to function within the social license of the area that they represent. And I certainly support our public health departments in helping to protect the health of the general public. For our part as a state, we're taking the action to be ready. Whatever the decision of local governments are, we want to make sure we have enough hospital beds. Whatever the decisions of local governments are, we want to make sure we have enough monoclonal antibody treatment. Whatever the decision of local governments are, we want to make sure that people across the entire state of Colorado get vaccinated and get boosted when they're eligible. In fact, one of the reasons that we are handling this current capacity in Colorado is because we do have a higher vaccination rate than many other states. We're at about 81% of adults vaccinated, 92% of people 65 and up. I would worry a lot about where we were as a state if our vaccination rate was 20 or 30 points lower. Our hospitals would very likely be overwhelmed at this point. Of the 1,500 plus people in the hospital, just over 1,300 are unvaccinated. Between 200 and 300 are vaccinated. So this is the crisis element of this is we need to be ready to handle the unvaccinated filling our hospitals. Again, to a certain extent, of course, it's their responsibility. It's their choice if they don't take the step to protect themselves. When it becomes a collective responsibility is when our hospitals are at capacity and other people aren't able to get the surgeries or procedures that they need. And right now our hospitals are able to handle all of the acute and urgent care needs, but there's absolutely elective surgeries that are being delayed. And that's very frustrating for people who need a knee replacement or have had a back injury and might have to wait a month or two for a surgery that they expected within a week or two. And so that's where we are right now. And we're very supportive of steps that all of our county health departments are taking that are consistent with the values in their area. Yeah, go ahead. Yeah.
they're taking these steps because the state isn't taking a step. So what would it take for the state to take a step? And is it fair to put this burden on them when we've seen mass resignations, we've seen threats against them?
Well, I've made it clear that it's not something that we're considering as a state. So if communities want to wear masks, they can implement that. I think that what's being lost here is the most important message, that you should wear a mask when you're indoor around others to reduce your risk of contracting COVID-19 and reduce the risk of spreading COVID-19 to somebody else. And to be clear, it's not as effective as being vaccinated. You should get vaccinated. Vaccination is more important. If everybody was vaccinated, no one would be wearing masks. We'd be out of this pandemic. But the reality is that about 19% of Coloradans aren't vaccinated, and they're still filling our hospitals at very high numbers. And communities are looking at different steps that they can take to increase the vaccination rate and reduce the spread of the virus.
Governor Jesse at the Sun, can you expand a little bit on the social license aspect that you were talking about, that the counties have social license to go ahead and issue this? Obviously, the virus doesn't care about social license. And I'm also wondering, too, if you can kind of provide an update on the hospital bed expansion efforts.
Yeah, so on the hospital bed expansion efforts, we expect to be on track to meet our goal of 500 new beds by mid-December. I'll have to give you the date that we set out for that, Jesse. I believe it was a particular date in mid-December. But we're on track. I get reports on it every day. And again, that'll be a combination of acute hospital beds and step-down beds that have the result of freeing up a hospital bed by allowing somebody to be non-COVID to be released earlier to a different standard of care. So we expect we'll be at the 500. We hope we don't need them. We hope that every single one isn't taken, but we absolutely as a state need to have that buffer margin to make sure that we're able to continue to serve those in medical need, both COVID and non-COVID. So look, we're in a very different situation than when, of course, we took statewide action before there was a vaccine around mask requirements. Right now, somebody who's vaccinated has, from today or yesterday's CDC analysis, 14 times less risk of death than somebody who's unvaccinated. We see similar statistics here in the state of Colorado. Even greater level of protection for younger people, effectively very close to zero. People in their 20s, 30s, 40s, even 50s who are vaccinated have died from COVID. There are still some fatalities in the older age range, but at least 14 times safer. And when you're dealing with a virus that is 14 times less deadly than COVID, you're dealing with a virus that's more in the realm of a normal virus. It's more in the realm of the 500 people we might lose from a flu in a tough year. We had lost 9,000 people, and so if you reduce that, that's about what we would have lost 600-700 if everybody was vaccinated, and it actually would be less because it also decreases the spread of the virus. But assuming it doesn't do that, you would have lost a much lower number. And frankly, if COVID-19 was 14 times less deadly, the state would not have taken a single action around social distancing or masks or anything like that at all at any time. Here's the challenge. There's still 19% of Coloradans that have a 14 times greater risk. And the decision of how we address that, there's no right or wrong answer. I hear from people all over. Some people say it's their fault, let them die. Others say, no, we love them. We want to offer them a higher level of protection. Others say it's not, it's their fault, but when they're filling our hospitals close to capacity, it's a time for, a regional or local action. So, as I said, I think what's important here is that it's an opportunity for people to reflect their values in their local leadership. I have great respect, regardless of the decisions that local leadership make. Right. So you have, I think it's in poor taste to attack, county health officials in Douglas or El Paso County and somehow say that their decisions are not protecting the public. With the same note, it's going after public health officials in Jefferson County or Denver because they're taking that extra step is also not fair, because they do protect. Everybody values our freedom and we value our safety. And whereas we're no longer in the stage of the virus where it is a high rate of hospitalizations and deaths for everybody, 80% plus of Coloradans are now in the stage where it's more similar to an endemic virus. The vexing part is the 20% that aren't protected and how it still has a death rate of 14 times higher for that group. So we support local communities in addressing that. That's a big, diverse state of Colorado, and we think it's important to try to work with county health departments and local governments wherever they are on that continuum of doing the best job that they possibly can, protecting the health, the safety, and the freedom of their constituents.
Hi, Governor. John Daly, Colorado Public Radio. Thanks for taking our calls today. I wonder if the state's considered sending masks, like N95 masks, out to residents who might want them, or having some sort of online system where they could order them as a way of both making them available, but also sending a message about the quality of masks. Not everybody wears the same quality or wears them properly.
Yeah, so that's a good point on masks. There's a hierarchy of masks effectiveness. There's cloth masks. Then there's this kind of mask, which I routinely wear. This is called a surgical mask. This is a higher efficacy level than a cloth mask, but it's also not the gold standard for masks. The gold standard for masks, what people, for instance, even before the vaccine, would literally wear in COVID wards and usually not contract COVID, doctors, nurses, et cetera, are the N95s, KN95 masks. The state has been making them available to schools across our state. I will look into our supply to see if there is a possibility of increasing the supply to the general public. They are available at stores now. That's another big difference from where we were early in the pandemic. We make them for free, available for schools, for both teachers or students. We'll look into what else that we can do to make them more widely available. But a good candidate to wear one would be somebody who is older, at great risk of COVID-19, hasn't gotten their booster yet, or hasn't been vaccinated. A KN95 or N95 mask would offer the highest level of protection for that person. And again, for those who are not interested in wearing or acquiring KN95, surgical mask would be the next step. And then cloth masks, as well as there were some studies early on that showed that cloth masks were more effective than the sort of scarf type mask that people might wear. But I believe all of those are a form of mask wearing. All of those are helpful, whatever you feel comfortable with. And, you know, as I said, I personally usually wear a surgical mask when I'm in an area that requires mask wearing. I want to go to Megan and Jesse's question again on this sort of what's local and what's state. There's some governors that have taken different tacks. There's some governors that have outlawed mask wearing. They've said no jurisdiction can have it. You can't require masks. There are other governors that said everybody's got to wear a mask everywhere across our entire state, even in areas that don't believe in the value of mask wearing and don't want to wear them, and the enforcement apparatus wouldn't support enforcement. We've taken a line here where we are supportive of our local communities in recognition that we have a very diverse state. I would never ban local jurisdictions from implementing public safety requirements, and I don't want to force them to, and wouldn't force them to either, given that we have a vaccine that's over 90% effective, which is the big change from where we were. At this point, the vaccine has been so widely available, those who aren't vaccinated have made a conscious choice not to get vaccinated. That wasn't the case in the early days. Vaccines were hard to come by. There were lines. It was difficult. At this point, it's been available for so many months in so many places. I believe that every Coloradan has walked by, driven by, seen several different opportunities for them to have gotten vaccinated. Stand-up clinics, buses, their local pharmacy where they were going for something else, the grocery store. So at this point, those who aren't vaccinated have made a decision. I believe it's a poorly informed decision. I believe it's one that's not driven by data. It's one that I truly hope and deeply hope that they reconsider urgently. But they have made a conscious decision to avoid being vaccinated, and to a certain extent, they have to live with the consequences or die with the consequences.
Hi, Governor Seth of the Gazette. Can you give a little more, or an update, I'm sorry, on staffing reinforcements to the state other than the FEMA teams in Pueblo and at UC Health? And second, on your comment about local versus state, I don't know if you followed what's happening in Aurora, because because the Tri-County Health dissolution, part of Aurora is in Douglas County. And so now, including some people in Aurora, including the mayor, talking about whether they can even enforce Tri-County's mask order because of that. So that's a unique situation, but it does feel like a limitation of your position. Thanks.
What was your first question?
An update on staffing reinforcements.
Yeah, so we'll be happy to give that to you. We do have the FEMA teams on the ground. There's also additional contracts for additional staff around the monoclonal antibody treatment. The buses, for instance, are fully staffed through a contract. The 5, there will be 10 in early December. So those are all additional staffing. And then we've worked with every provider around their surge staffing as well, the major hospitals, that is, around what theirs looks like. And we're augmenting that where we can with additional resources, both FEMA and contracted from the state, to meet the needs of everyday Coloradans during this wave. I think what's lost on these, discussions of what's in what county or where is that the best advice that anybody can give from the medical perspective is wear a mask in crowded indoor areas and around others. It's the polite thing to do, even if you're not doing it for yourself. Do it out of decency, do it for your neighbor, even if you're fully vaccinated, even if you're boosted. It is a polite way to support those who are unvaccinated and support those who might have weakened immune systems. So I wouldn't be checking zip codes. I wouldn't be looking at geographic lines out of decency. I would simply advise our fellow Coloradans to protect and love thy neighbor by wearing a mask when they're indoors around others. Mm-hmm. Yes, some are. We can get you the rundown. I, for instance, know that the 20 that were added at Parkview with staffed by the FEMA team, that's part of that 500. There are more that are. We can get that to you. It was the build out was roughly half and half, about half full acute hospital beds and half beds that would free up hospital beds by being able to locate patients there. And I'll see what we have that can be made available on that tracker.
And then a follow-up to that question, in regard to some people saying let them die, are you saying that's an acceptable position for counties to take?
No, I think that I would hope that every county health department is encouraging mask wearing, as I have done here. I think it's a neighborly thing to do. I think it's a loving thing to do. Is that we should protect ourselves. Just like if you're going to a Thanksgiving dinner and there's that one uncle that didn't get vaccinated, if you are symptomatic and you should not attend. You might be frustrated by the decision not to get vaccinated, but I don't think you want to kill them. As a matter of personal responsibility, most Coloradans have chosen to do the right thing and protect themselves, but we love even those who haven't, and that's why we're rapidly expanding monoclonal antibody treatment. Of course, that'll also benefit some folks who are vaccinated and at risk, but the highest risk group are those who are unvaccinated and older. And we care about and love everybody in Colorado, even folks who don't make the best informed decisions.
Governor Polis, hi, Sarah Flower with KSUT, Four Corners Public Radio. This week, last year in 2020, marks the highest hospitalizations as of yet. Curious if there are any other tools in your tool belt, if we've learned anything from the past and moving forward. And also part two is that this week also marks 3 weeks when children 5 to 11 are now eligible for the second dose. Any update on that?
I do have an update on that. Let me find the kids one. I'll look for that in the meantime. Just because it was the highest week last year doesn't mean it's the highest week this year. As I said before, sort of grad students will be writing their theses on why and where and how COVID spreads for decades, and the truth is nobody knows now. We certainly hope there's a pattern there and it starts to decrease, but there's really no consensus. All of our projections that we've shown recently, by the way, the COVID projections are much more refined science than they were, a year and a half ago. We had very little information to go on then, but they show a band of where we could be based on where other places have gone and where we've been. So we have kind of the highest level, they think, that's within 90% confidence, the lowest level of 90% confidence. That's why we're making sure we have the 500 additional beds. It's not because we think in a likely scenario we'll need every single one of them, but we want to be ready if it's above that kind of average. If it's in that realm of the 90% possible or 90% likely, we want to make sure that the state of Colorado is ready. Maybe we'll need 100 of them, maybe we'll need 200 of them, maybe we'll need 0 of them. But the truth is we won't know until after the fact. So we absolutely need to be ready. We will be ready. We're on track to do that. Let's see. Here we are. 39% of kids age 5 to 17 have at least 1 dose of the vaccine. I think we also have that broken down by 5 to 11. I don't have it in front of me, but we'll be happy to give it to you. That is a major push now. Right now, I also have the figures for hospitalizations and pediatric hospitalizations specifically. 19 0 to 11-year-olds are hospitalized from COVID right now, and 12 to 17-year-olds are hospitalized from COVID. And I often report this out too. Of the 12 to 17-year-olds hospitalized with COVID, 0 are vaccinated. Even though we're close to half of all 12 to 17-year-olds vaccinated, no vaccinated young person has had to go to the hospital from COVID. On any given day, we have about a dozen unvaccinated young people in the hospital from COVID, 2 dozen if you include the even younger kids. So, it's frustrating that many parents and young people haven't made that decision yet. Our kids got vaccinated at, Denver Zoo 2 weeks ago. We were thrilled to do it. What a great triumph of modern science to protect them. Many parents are doing the right thing, and those that haven't yet, I encourage them to do so and protect their kids. Their effective risk, which is certainly lower than adults if they're not vaccinated, but is very, very much exists, pretty much goes to 0 once they're vaccinated.
Governor Dave Perry at the Sentinel calling. I was wondering, we've heard several times, and you've mentioned it too, that people who have previously tested positive for COVID should get the vaccination. And I was wondering if the state monitors how many people in Colorado previously infected have been reinfected with COVID, or if anyone in the state is looking at that.
Yeah, I haven't. I've had my last presentation on that, Dave, was a couple of weeks ago. I know we have that. Let me see what we can prepare for you. I would add that the scientific consensus is that what some call natural immunity or immune response after contracting COVID is an increased form of protection. The question marks are around how long it lasts, the exact level of protection that's provided. And then finally, whether, and there's some data to support this, those with very mild or asymptomatic cases have a lesser degree of protection than those with more moderate or severe cases. So those are all question marks. There's preliminary studies that have been done in those areas. Not enough conclusive information. There has been some fairly conclusive studies around what's called the hybrid immunity, which is a form of immunity that I happen to have, meaning I've had COVID and I've gotten the 2 shots. I've also gotten the booster. For those who've had COVID and get vaccinated, they have an even higher level of protection than those who have just been vaccinated. But those who just have natural immunity alone, there's still a lot of question marks around how long and how effective. So it's unequivocal. If you've had it, you don't want to get it again. You want the best level of protection, get vaccinated. But yes, those who've had it do have some level of protection from their natural immune response and antibodies. And we'll get you, Dave, the reinfection rate stuff. I don't have it in front of me.
Hi, Governor. Chelsea Rensel with CareDO here in Colorado Springs. Quick question. I think I understand your position on masks and vaccines and statewide restrictions, but one thing I'm curious about is, as we're seeing an increase in cases in Colorado, are there any out-of-the-box mitigation efforts that the state is looking at as far as, I don't know, encouraging more remote work if possible? Is there anything that you guys are looking at as that type of mitigation effort?
Yeah, I mean, we first of all, we often model what we do as a state. We're a large employer ourselves. Our own employees, 31,000 of them, are either vaccinated or they have to test regularly. We still implement remote work, not, of course, nearly to the level that it was in the height of the pandemic, but many of our agencies, folks are in 2 or 3 days a week. Those are certainly best practices that many employers and office environments are looking to do, especially during this height. Some have delayed when their employees are coming back every day. Some have a staggered schedule. We have good guidance from the CDPHE, and we would certainly encourage employers to take a look at that, to implement methods to reduce the spread of coronavirus within their workplace.
Thank you.
Is it responsible at this point to tell people that it's okay to gather for Thanksgiving, given what our hospitals are dealing with?
No, if the hot Thanksgiving parties are fully vaccinated, the risk is as low or lower than it has been in any other year that we've all been alive. It's simply a low risk if you're vaccinated. Now, you're going to want to make sure folks are also boosted, especially Granny and Grandpa, and hopefully they got boosted, and they certainly should. But the risk is much, much, much lower for those vaccinated. If there were just 230, what do we have, 256 people who are vaccinated in the hospital, we wouldn't be having this press conference. We wouldn't be talking about masks. We wouldn't be doing a darn thing, because guess what? It's real life, and people get sick, and people have to go to the hospital, and that's just a reality. The reason we're here and talking about this is because there's 1,320 people who are unvaccinated in the hospital. That's the only reason Denver and Jeffco are even talking about masks. That's the only reason that the state has comprehensive guidance and is working on increasing hospital beds by 500. That's the only reason we have 10 monoclonal antibody buses around the state in early December. We work with our hospitals to increase service of monoclonal antibodies even more. So no, if folks are vaccinated, they should feel safe. And as I said, if there's that one or two unvaccinated family members, we care about them, we love them. Symptom checking and testing are good ways to protect them, and engage them in a respectful discussion about the benefits of vaccination, not in a hostile way that locks them down, but just in a fact-based way that's appropriate within your family, letting them know that the family members care about them, love them, and want them to be here for many years to come. Thank you, everybody.